2, 1.
Good afternoon, everybody. This is the Public Safety Committee meeting calling to order on Zoom. This is Tuesday, September 8th at 11:31. On our agenda today is Chief Hagan, who is going to discuss the police stats at this point. Chief, you're up on the floor, so to speak.
Good morning, everyone. Before you are the public safety reports for the first quarter and second quarter. The stats also in the second quarter report show that for the first half of the year and the comparisons between 2018, 19, and 20. I'll start with the first quarter. Obviously, mid-March is when COVID hit. We noticed the decrease in call volume for a while, and it's back up to relatively normal levels now. But in the crime stats, you'll see from 19 to 20 in the first quarter, homicide down, rape down, sex assault went down, and robberies went down. Regular assaults went up 17%, but everything else was down. Burglaries increased by 4 from the first quarter last year and the first quarter this year, but thefts were down, vehicle thefts were down, and controlled substances were down. We did have one arson where we didn't have any in the first quarter last year.
Any questions from anybody?
I have more on the statistics through the first half of the year through June 30th show that we're even with last year for homicide. Rapes went down significantly, 87%. Assault is down and robbery is down. Sex assaults increased from 18 to 21. Burglaries are down by 1. Thefts, another significant decrease, 28%, from 286 to 204. Vehicle thefts were down almost in half, and controlled substances were down. That's the number of arrests or investigations started. Arsons increased again from 1 to 3 from last year, but most of these numbers are down, indicating a couple of things. Good law enforcement, but also I would have to think, especially in the second quarter, that was affected by COVID. So I think it's both. As our younger officers get more experienced and get more of a handle on what they need to do and how to investigate crimes, they're getting better at what they do, establishing more contacts in the community and solving more crime. So things are getting better. Also, as you know, if you lock the right burglar up, these numbers can go down quite a bit in a flash. If the right people are in jail, your numbers are down, and if the wrong ones are out of jail, your numbers can go way up quick. So anyway, those are the numbers. There's some attachments behind that get more specific with regard to how many of each type call occurred during the time period, during the quarter, and I'm open to any questions.
It's to me, I'm going to open up to the floor to fellow councilman. John, do you have anything?
Actually, I must have missed that email. I did not get any of these numbers. Could you email those to me again, Chief? just so I can take a look at them?
I didn't email them. I gave them to Janice Frank. I gave 14 copies to her.
Oh, okay.
I thought it got distributed to you.
It may have, and maybe I just missed it somehow.
Yes, I emailed them out along with the codes report. If you want to look through it went all
Okay.
together.
All right, I'll double check. It's probably my fault.
Janice, did you send out the fire reports that Renee had sent you?
I got the fire. Yeah, I got the fire.
Because that didn't make it on the agenda somehow.
Oh my gosh, Chief, I'm sorry I forgot to put that on the agenda, but I did send them out.
Okay.
I saw the fires and I thought, I wonder why that's here.
Dawn, I just emailed you the lot, all the except for filing.
Okay, I think I just found it actually. I apologize. All right, yeah, we're good. But no other questions for me anyway.
Adam, do you have any questions?
No real questions. Just going through the data, Chief, to your point, over the last 3 beginning parts of each year, you see a downward trend, which is great to see. I know you've talked a lot about community policing, and saw a great example of that the other week with a lot of the police officers on the street engaging the community playing. And, I think that's a direct result of that. So I would just say, keep up the good work with that. I was really happy to see that good example of community policing the other week that was shared up on social media. I love seeing it, want to see more of it. Keep up that. I think it's a great thing.
I think
Thank
the
you.
impromptu togetherness at that point, I think that's what was so heartwarming. And I think the kids, I mean, the look on the kids' faces was priceless. It really was. So we see how the interaction between the officers and the youth can really command some respect, all the way around. So I think that was such a positive, Chief. Plus, looking at the figures, it's going to be interesting to see at the end of the year, because you and I both know things have opened up a little bit more throughout this, city. I know we've seen some more people traffic-wise in the store and on the street. And the thing that's the most interesting is, for me anyhow, the amount of tourists that are coming through and stopping in the city. That I find interesting, especially with everything that's going on. But a lot of the locals, I know some of the stores, we've all cut back on our hours. And, when we're open, traffic is showing up more and more. So it's going to be interesting to see whether the fall is going to bring an uptick in anything. And let's keep our fingers crossed that it doesn't. And as you said, the dogs are doing wonderful, and the dogs are helping tremendously as far as keeping up with things in the city. So, and like I said, I can't wait to meet the dogs.
Thank you. Yes, the real challenge when compared to the last 10, 12 years prior to me becoming chief was to get away from a sense where it was you were being forced to do community stuff all the way from the mayor's office down. And in this past year and a half, what we've emphasized with the supervisory corps in the department is to try to create an environment where our officers want to do this. What you saw on the social media was not something they were told to do. They just did it. And when our officers are thinking like that, it changes everything. It reduces our liability drastically. They start thinking of ways to save the city money long before they become supervisors themselves. They think about ways to take better care of their equipment. They become more self-disciplined, and they're able to serve the community better. They're thinking of the right things and not just that they're being forced to do this or that. So the environment is changing. It has changed. It continues to change for the better. And I think you're going to see more interaction like that on a voluntary level from our officers in the future. Thank you.
Chief, can I ask you this? Do you think maybe because we have such a young force that there's that youthfulness that spreads throughout the city? They're not set in their ways yet, and they're enjoying their job at this point and enjoying the interaction with the public. Do you think maybe that has some of it?
Yes, I do. I think there are great advantages to youth. And then there are some disadvantages. The lack of experience is a challenge sometimes, but we have very intelligent young officers with a wide range of life experiences. Even some of the younger guys and gals have a lot of life experience that they bring to the table. But yes, more pros than cons. Obviously, when you have a young force, they're very proactive and want to get out there and prove themselves and do a good job.
We're kind of experiencing that with city council. We have the youth on city council, and we have the experience on city council. And, the youth is bringing us a lot of new ideas, and it's just, sometimes it is challenging to the brain, because sometimes when you've been on council for a while, it's hard to change sometimes, and you've really got to get that brain moving in another direction. And, for me, I can see those challenges, and that's what I see with the youth of the police department. I think it's really, you have a mixture there, you really do. And I think at times, like you said, it can be a challenge, but I think it's a good challenge, because most of the time I think it's positive.
Yes, I agree. Go ahead, sir.
Sorry.
Yes, John.
Yeah, sorry, just real briefly, Chief, could you, I see 100 total incidents here of police miscellaneous. Could you maybe just give me a few examples of what would be considered a police miscellaneous call?
Yes, a non-criminal call, like that doesn't fit any other category. Like assist another agency has a category, and
Right.
the old codes that we use to code reports with don't apply in our new records management system. But it's an action taken by an officer, whether proactive or some could be generated by 911 calls, but typically it's not, and it does not result in any crime. If an officer even detects a crime, then it would not apply to that category, even whether there was an enforcement action or not. It's totally non-criminal.
Okay, thank you.
Adam, anything? Chief, want to thank you very much. It's always interesting to look at the statistics when these reports come down. And I think this year has been really interesting, especially with everything that's going on with the COVID. Like I said, can't wait to see what the end of the year brings, and then start 2021 to see where we go from there. But let's keep our fingers crossed that things stay below all these numbers at this point. And thank you, and please stay safe. Thank you so much. Next thing on the agenda was Citizens Core Report from Jeff Reeder. Josh, have you been able to get in touch with Jeff?
I have not heard from Chris Cooley on that, whether he was able to or not. I will call Chris real quick and find out where he's at with that.
Well, we're going to jump to, while you do that, we're going to go to any related items. And since we have Chief Killian there, let's go put you under any related items. How's that sound, Chief?
That works for me. We can, so I'm assuming you guys in front of you only have the August report. Is that correct? Okay.
August 2020, right.
Sure. So I can touch on that real quick, but first off, over the last couple weeks and over the next couple weeks, Chief Calderini and I are working on a much more comprehensive quarterly report that we're going to provide you guys much in line with the police department. The monthly reports that we've been providing in my experience have they're not great. So I think there's a lot more data that we're compiling, including training hours and response statistics and turnout time and other associated things that we want to start providing Public Safety Committee with. So I can briefly touch on this August report, but what you'll see hopefully for next public safety meeting will be quarterly reports up to up through September with much more detail. Really, as Chief Hagan pointed out, our incident statistics have been much the same through this year. We generally see about a 1 to 2% uptick in overall incidents on a yearly basis. This year, the months, basically the last portion of March, April, and May, we were down almost 20%. But the remaining months, we've been averaging 5 to 7% increase in call volume. So really, we're about 90 calls different to this point. So, but our yearly fires are up. The biggest decrease we have seen is in our alarm calls, which would make sense because those are automatic fire alarms and incidents where, when we have people in commercial buildings shopping and, those alarms would tend to be higher. So that we can kind of assume is directly COVID related. So I guess my question for you from a public safety committee standpoint, obviously we know the data we want to provide to you, and these reports I think have looked much the same for the last several years. Is there anything specifically that you'd like us to include from the fire department standpoint?
John, Adam? Anything from you guys?
One thing I'll mention is we're starting a few separate initiatives specifically around the area of community risk reduction. And community risk reduction for us is pretty encompassing, and it could be likened to the police department's community policing. It's the programs that we're doing proactively out in the public. One that we're kicking off here within the next month is called the Williamsport SAFE program, and the SAFE stands for Smoke Alarms for Everyone. We'll actually be out doing door-to-door kind of door knocking campaigns, doing smoke alarm installs, home fire safety visits. We really intend on ramping up our community risk reduction efforts and our prevention efforts. The intention was to get that started in the spring with the change in administration, but it was kind of hard to do a door-to-door campaign during COVID. So I really want to make sure for you folks from the public safety committee standpoint, you're getting a good glimpse into the data as far as what we're actually doing, the contacts that we're making, and I think what you'll see is a much more comprehensive, inclusive document here. So I apologize for maybe the lack of information over the last several months. It's been hit and miss with us all during COVID.
Well, no, we understand all that. Back to the smoke alarms. Did you get a grant for this?
No, so touch on a couple things. Every year, we're the recipient. I'm sure some of you are familiar with the WNEP Operation Save a Life. Does that sound familiar to everyone? The smoke alarm program that WNEP does. So the Bureau of Fire is actually the county's collection. We're the primary point of contact for the county from a smoke alarm standpoint. So we receive through WNEP the entire county distribution of smoke alarms, and we distribute those throughout county fire departments that need them. And quite frankly, we don't give a whole lot out to other county departments. So we have a large cache of smoke alarms. And then along with that, we work hand in hand with the Red Cross, and the Red Cross generally provides us with a matching number of smoke alarms. So at any given time, we have 1,000 to 2,000 smoke alarms on hand. We do installs on a very regular basis. One thing that we have stopped doing is handing smoke alarms out at fire headquarters. We actually will not give you a smoke alarm unless we come out and install it for you. Because what we found in several instances, we've handed smoke alarms out and we go there later on for maybe a medical call or a fire alarm or whatever it may be, and that smoke alarm sitting on the counter, not installed. So we've made it a point to make sure that we're going out and providing that installation service. So we receive those smoke alarms on a yearly basis. We do have a grant out right now that was wrote in the spring. It's a federal grant for for community risk reduction, and that is specifically built around the smoke alarm program. So that grant would provide funding for an individual to manage the program on a daily basis, along with the funding to purchase a large number of smoke alarms and carbon monoxide alarms. So right now we haven't spent a penny on smoke alarms in a decade at least. All our time and resources is into knocking on doors and putting the feelers out there to make sure we're getting them out and installing them.
Chief, this would be mostly for homeowners, because if
It
you're a rental, it has, the rental inspections all come through with the smoke alarms have to be with the codes department. It has to be up to, codes with that. So the homeowners are the ones that you're giving these out to at this point, right?
That's correct. I will say we target residential owner occupied structures. Those are our primary area of concern, obviously, because of the rental inspection ordinance. However, there's several challenges with the rental inspection ordinance. Number one, it's a 4-year cycle. So what's done today from a rental inspection doesn't mean that's going to be there tomorrow, a year, 2 years down the road. So we get a lot of renters that come in and tell us, hey, I don't have smoke alarms in my house. They may call us up. So we'll actually go out, do a check of the property. And if it is a rental property and there are no working smoke alarms, we will install an alarm. We'll put one smoke alarm in just for safety's sake, and then we'll file a codes complaint with the codes department so that can be addressed. So we do install smoke alarms in rental properties, but it's only as a last resort if there's nothing present. And then we follow up with the codes department. But I would say 95% of what we do is residential owner occupied.
Okay. And you mentioned something about carbon monoxide. Do you give those out also?
We give them out on a very limited basis because they're quite expensive.
That's why I'm asking that.
Yeah, the ones that we have given out, we've received through grant funding. And the Lycoming County Safe Kids, the Lycoming County Health Improvement Coalition, we have the Safe Kids organization that we're a part of. We've worked through Safe Kids on numerous grants for carbon monoxide alarms with matching funds because they average, $30 a piece. So we do install those. Generally, when we have them, they go pretty quick. And we're very, I don't want to say picky, but we only put them in high risk homes, where there's children present, or we try to make sure that we're doing our due diligence on those installs because of the price of them.
Fantastic. As far as any information on what you would want to put on for us to look at, the one that always I find amazing is the medical one, that you're called out on every medical, and that's a lot of calls. It really is. But I guess it's something that has to be done, isn't it?
Yeah, so we actually don't respond on every medical call. If we did, the hospital units, Susquehanna or UPMC handles about 8,000 calls a year in the city. We run what are classified as priority 1 calls. Those are any significant life, I'll call them life risk, chest pains, cardiac arrest, shootings, stabbings, high priority incidents. And we do that, frankly, because we a lot of times are on scene first. All of our personnel are EMTs. We provide immediate first aid. We have multiple CPR saves every year, providing direct intervention and working with the hospital staff. We average well over 1,000 EMS responses a year. Again, and we call that QRS, so quick response service. We're a QRS agency, so we don't transport, we're not putting we don't own an ambulance, we're not putting them in the back of the ambulance and taking them to the hospital, but we're providing a rapid EMS service that we get on scene, treat that patient maybe before the paramedics arrive, and then, assist them with medical care. So, that's a big part of what we're doing, and frankly, something that we're training more on, we're doing more on a regular basis, and that call volume is going to continue to grow and expand.
Let me ask you this. Did I misunderstand? This goes back a couple of years now, that if you are called out to somebody who has, say, fallen and I can't get up,
Mm-hmm.
Is it up to the fire department to do this?
Yep.
Did I
Yep.
understand correctly that the ambulance people that come, they aren't permitted to do this?
So it's
Or
not
did
that
I
they're
get
not
that
per-
wrong?
It's not that they're not permitted. So we call those calls, those incidents, lift assists, and you'll see those under service calls generally on the report. That would be your elderly patient that falls, that is uninjured and just needs help getting up, getting into bed, getting back in the wheelchair, whatever it may be. So because they're not injured, right, we're not going to send an EMS resource because they're significantly taxed on emergency calls. So, and this is nationwide. This isn't a Williamsport specific issue. Generally, the fire department are the ones who pick up the slack for that. So we have seen the call volume of lift assists dramatically increase as the population ages nationwide. So going back to the community risk reduction programs that I spoke about, one of the things that we're working on is with some of the resources at the hospital, where our department and our personnel will actually go out and deliver fall prevention programs. So in our high risk areas, the elderly high rises, we'll go with our personnel and talk about fall prevention, making sure that you don't have cords across your living room, making sure you don't have rugs that you can trip over with your walker. You have handrails on your steps. So all those things, because that's truly, again, going back to the holistic community risk reduction approach. The fire department, we're not just smoke alarms, and showing kids the trucks. It's pulling the data and looking at our incidents that we're responding to, prioritizing them as far as the highest risk is associated, and trying to address them before they happen. So really that's, you'll see a lot coming from us over the next year or more on the community risk reduction front, which is all encompassing. So long answer to a short question. Yeah, we run those calls that we refer to them as lift assists, and we run them a lot. So, addressing those is a significant part of what we're trying to do.
Fantastic. I'm sorry, guys. I took up most of the questions. I apologize. John, Adam, anything?
No.
Nope. Chief, I want to thank you very much. Okay, and look forward to the new program that you're going to be setting up. If you want to set this up for the next public safety meeting, fantastic. Okay, if whatever's convenient for you at this point. But I think we all enjoy looking at the statistics of what goes on in our city. It's amazing to see what the police and fire all have to do, and I don't think the public realizes the amount of time that is spent in our city with our public servants at this point. So thank you very much. Other than that, I guess we still haven't heard from Jeff Reeder, right?
That is correct. Chris forwarded the meeting information over to Jeff, and Jeff has not responded, but he did forward that over via email.
Okay, fantastic. I have nothing else on the agenda. Anything from the administration that you would like to, anything else from the chiefs at all? Anything from Adam or John?
Chief Hagan, did I see that a few of our new vehicles are here now in the parking lot?
Yes. I didn't know if all of you had a chance. I know I talked to a couple councilmen about it. 3 new Tahoes. They're out back. 2 of them are out back. One is getting the computer put in it today. So they should be ready, all 3 of them, by Wednesday probably.
Great. No, yeah, they look great. The new color scheme is nice.
Thank you. It's always you never know till you get them here. It's one thing to look at it on a computer screen, but we're pretty happy with it too.
No, great. That's
Well,
it.
isn't that the truth though? To see it on the computer and then in person. It's like, oh, you keep your fingers crossed. I can't wait to see them, Chief. I know you told me that they look fantastic.
I can send you pictures. We have some pictures, so
Well, that would be fantastic.
send them out to all of you. Thank you. And then just to add to what they were talking about there, we do have a more in-depth reporting system for interdepartmental statistics and activities and operations. And that you'll be seeing that at the next public safety meeting as well from the police. Thank you.
Fantastic. And Chief Killian, when are we going to see the new assistant chief?
He's right there.
Listening.
Well, hello there. How are you doing?
Fine, ma'am. Everything's going well.
It's nice to see you in person.
Yes, I know. And we'll
Sort
meet
of
one
in
day.
person.
Sort of, yeah. Very
But
nice to meet
eventually we will get to meet all of us, everybody in person again, hopefully
Yes,
sooner than later.
you.
Yeah,
it's good to see you.
and I will say Chief Calderini's been incredibly busy and a huge help with his experience and background. One of the things you touched on was EMS. Chief Calderini's a paramedic. He's been a paramedic for many, many years. So he's really, we're looking forward to continuing to expand our EMS expertise. And, he's been helping with a lot of data gathering, which is something that he's got a lot of experience in. So it's been a big weight off of my shoulders, and, we appreciate the support.
Well, I hope you're enjoying coming to a small town since you came from Pittsburgh, right?
Originally Pittsburgh, yeah. But
So-
we're getting settled in.
Do you know what? We have a great city, though. We do with a lot of things to do in this city. So
Yeah.
I appreciate you coming here.
Thank you. Looking forward to it.
Fantastic. We will see, like I said, we'll see you in person eventually. Since there's nothing else, would I take a motion to adjourn?
Second.
All those in favor?
Aye.
Aye. Good to see everybody. Talk to you all later.